Welcome everybody. Thank you so much for attending today. So the Dementia and Housing Working Group, the DHWG, is excited to launch this inaugural webinar in a quarterly series focused on housing and dementia. And I'm very, very proud to have been asked to chair this first one. So the group started hosting sessions pre-COVID, and the idea was sparked after co-authoring the dementia-friendly housing guide with the Alzheimer's Society, where it became clear that many organisations still viewed dementia as an issue to be tackled by older persons, landlords, when in reality, we know that the vast majority of people living with dementia live in general needs accommodation or in their own homes. So I think we have next slide, Sally, please. Sorry, next one, move along. So you're probably familiar with a lot of the statistics around dementia. A few of those are on this slide, which I won't really go into, but we can see that it's still a challenge that we all need to rise to. And what always affects me is particularly those people who live on their own with this. So very, very challenging. So the DHWG aims to promote and influence the contribution of the housing sector in improving health, well-being and quality of life for people living with dementia. As the only national group focused on housing and dementia, this is not about just talking. It's about bringing together a wide range of volunteer stakeholders with an action-oriented ethos and a track record of producing tangible outcomes. So we'd like to dedicate this first webinar to the late great writer and activist Wendy Mitchell. So Wendy was diagnosed with dementia at a young age of 58 and spent years documenting her experience. And I think we'll all be forever in her debt. She really won over hearts and minds by advocating for living positively with dementia, and was also an author of several books on the subject. So my favourite quote from her was, "My diagnosis may have changed my life, but it will never change who I am." And I think we can all agree that it never ever did. So she was and will continue to be an inspiration. I'm sure we're all very thankful for all of the work that she did, and she'll be sadly missed, and love and best wishes to her family as always. So we have some fantastic speakers for you today, as this webinar addresses a range of topics, hopefully providing easy and actionable guidance to help organisations gather insights and then implement actions effectively. It emphasises the importance of making small changes that will make a really big difference, rather than having a focus on significant capital investments. So without further ado, I'll introduce you to our first speaker, Joanne Gardner. So Joanne is the Policy Coordinator for West Yorkshire Combined Authority, and she's going to talk to us about dementia-ready criteria for housing developers. So over to you, Joanne.
Thanks, Pam. Hi everyone, I'm Joanne. I support the West Yorkshire Dementia Ready Housing Task Force. If we can, next slide, please. Thank you. So the overall aim of the task force is to improve the experience of people living with dementia, and we work with partners such as housing associations, local authorities and third sector organisations, including the Alzheimer's Society, to develop dementia-friendly homes and services. Excuse me. It's not an easy task. I'm sure everyone on the call are all too aware that there's so many competing priorities and challenges facing the housing sector, and the task force currently doesn't have any funding. So we've been looking at what practical measures can be taken that are relatively low cost to deliver, but would have a meaningful impact on people's lives. We know that most people want to stay at home as they age, but we also know there's some common aspects of housing design that can lead to difficulties, such as isolation and falls. So what the task force has done is develop a list of criteria to support those working in the housing sector to make a home more dementia ready, all with the aim of helping people to remain living happily and healthily in their own homes for as long as possible. Research has also shown that some of the changes could actually help delay the onset of dementia and slow down progression of some of the symptoms. And talking of research, I should add that the list has been developed based on a literature review of key documents. Some of those you can see on screen now, and also in consultation with the ACID and Regen colleagues across the West Yorkshire Housing Partnership, who we work with closely. Next slide, please. So why and how should the criteria be used? Well, the criteria should be applied to all homes. This isn't just for old people's housing. I'm sure we've all heard this stat before, but there's only enough specialist housing for 5% of the over 65 population. I think it's even just been mentioned two-thirds of people living with dementia don't live in specialist housing, and a third of those live alone. We also know that the path to diagnosis can be lengthy, and of course we need to remember that dementia affects younger people too. The criteria should be relatively low cost to deliver, especially if they're implemented at a planning stage, and they're designed to be non-intrusive and non-institutional in appearance. We've had good news recently in that the West Yorkshire Housing Partnership has agreed to include as many of the criteria as possible on all new developments, and they're also considering how the measures can be incorporated in existing homes. So that might be in between tenancies, or it could be through planned maintenance, investment programmes. Energy retrofitting would actually be a good one to link in with, as a warm home can make even more difference to people living with dementia who are more vulnerable to the cold. We appreciate it won't always be possible to include all of the 10 points, particularly for existing homes, but it's really about identifying what is possible and working together and raising awareness. The Housing Ombudsman's spoken a lot recently about the term general needs, and they've questioned its use, and they've reminded us that general needs does not mean no needs. So whilst the criteria were developed specifically thinking about people living with dementia, we know that many of the changes will actually help people with other conditions as well. So let's look onto the criteria, please. Next slide. Number 1, front door that's easy to find day or night. So this is really taking a cue from extra care and older people's housing schemes, where the design and layout helps people navigate around where they live. We don't want people being afraid to leave their home for fear of not finding their way back. So this is about helping to maintain independence, exercise, and experience of the outdoors. It could be achieved by having different coloured front doors, or cheaper options could be distinctive wall planters or different coloured number plaques, as demonstrated on the photos there. Next slide. Number 2, step-free access into the home and step-free access to all external doors for new homes. Falls are more common for people with dementia. Currently, it's only in building regulations to have step-free access at the front, but I understand it's actually just a matter of detailing to get step-free access to all doors. So this could be an easy win for new builds. We know it is probably going to be more difficult for existing homes, so we're currently working with housing partners to explore what is possible. Next slide. Number 3, internal surfaces mitigate confusion. Dementia can change perception, and bold patterns such as stripes and zigzags can be perceived as moving objects, and highly contrasting floor tones or even different coloured doormats can look like holes or steps. Flex and flooring even can look like dirt, which if someone tried to pick it up, it could lead to a fall. So all of this really needs to be avoided. Next slide. Thank you. So number 4, the bathroom that's easy to find. Being able to find the toilet easily, especially during the night, helps people to retain their independence and dignity. So we've said that the bathroom door should be visible from a bedroom door. Next, please. Number 5, bathroom locks aid rescue. So this is in reference to existing homes that might have had locks fitted that are bolts across. Now, as per building regulations, the new homes have a coin slot on the outside of the door so that people can be rescued in an emergency. We're suggesting that for existing homes, when there's a change of tenancy or when there's other work going on in the property, any bolts that are still remaining on bathroom doors are quickly replaced. This is really an example of something that's very quick and low cost to deliver, but it could save someone's life. Next, please. Number 6, good level of natural light in all habitable rooms. Although this one is really difficult to quantify, it is really, really important. Pools of light or dark areas, stripes, shadows need to be avoided, and artificial light shouldn't be needed during the daytime for working or reading most of the time. We know that exposure to natural light helps general well-being, as well as helping people to recognise the difference between day and night, and it's another design feature that can again help to prevent falls. Next, please. Number 7, view of nature. This one can potentially be quite subjective, and we've had many discussions, but we're saying that the view from the window should include plants and trees, and that's more than one species, and they could be enhanced by some such as bird feeders. So the rationale for this is that there's evidence that connection with the natural environment stimulates memory, and it can actually slow down the progression of the symptoms of dementia. Next slide, please. Number 8, it's to outdoor space that's easy to navigate. So this is really about applying those tonal contrast issues to outdoor paving as well as indoor decorations, and again, avoiding steps wherever possible. So just making it really super easy to navigate safely. We know that outdoor activity helps the brain to process and coordinate, and of course vitamin D with exposure to natural light is really important for the body. Next, please. Number 9, amenities and other homes within 1 kilometre. People with dementia are less likely to drive, so having amenities close by is important for independence and promoting activity. And living well with dementia, as I'm sure you'll be aware, is as much about companionship and community as it is physical things within the home. So we've just tried to quantify that here with a bit further detail. Next, please. And then number 10, an active dementia champion within the housing organisation. So our housing partners have dementia champions, whose role it is to promote understanding of dementia amongst their colleagues, residents and wider community. And I think we'll all agree that housing organisations have a really important role to play in building dementia-friendly communities. And you'll see, and most of you may well recognise the lovely Wendy Wells there on screen, who are lucky to have in the task force as a champion for the Guinness Partnership. So that's a quick tour through the 10 criteria. We are currently working with an illustrator who specialises in technical drawings to develop a short illustrated booklet to explain it. And we know some of the concepts are quite difficult to quantify, so we're going to be using lots of illustrations and photographs to avoid being too wordy or too technical, but to really explain the principles as simply as possible. So that should be ready next month, and I'd be very happy to share that with you. So thank you for your time.
Brilliant. Thank you ever so much for that, Joanne. Really interesting stuff. Can I ask you just one quick follow-up question? Why are you not recommending things like installing grab rails, ramps, wet rooms, more signage? Why does that not feature here?
Well, the 10 criteria, they've really been designed to form the basis for dementia-ready housing. We know everyone's experience of dementia can be different, probably will be different, and people's needs will change as the disease progresses. So what we're proposing here are really for the early stage and to form a basis to build on. And in that, we knew it was really important to balance factors of cost, appearance and usefulness, because we're recommending these for every home, not just older people's housing. So we're really sort of keen that they couldn't look institutional or unattractive, and we didn't want cost to be a deterrent because we want everyone to benefit. But we hope and believe that we've developed a set of criteria that will allow people to enjoy a better quality of life for longer without there being a big outlay to it.
That's brilliant. That makes sense. Thank you. If anyone has questions for Joanne or any of our further speakers, pop them in the Q&A and we'll get to those at the end. Thank you very much for that, Joanne. I'm going to move straight on to our next speaker. So I'd like to introduce you to Andrew White. Andrew's the head of independent living at Irwell Valley Homes, and he's going to talk to us about the DHWG design guide. Thank you, Andrew.
Thank you very much, Pam. Yeah, good afternoon, everybody. Pam said I'm Andrew White from Irwell Valley Homes, member of the Dementia Housing Working Group. And for about the last 12 months, myself and Ali and Vanessa have been working on the design guide, inspired by some work that was carried out by McCarthy and Stone initially. So I think you can credit for this work as well. What we want to, move on to the next slide, please. Thank you. What we wanted to do was bring together a design guide that sort of set out the relatively simple things that housing providers or occupants of homes can do to help them live in their homes safer for longer if they have a diagnosis of dementia. Some of the things I'm going to mention now have been covered by in Joanne's presentation, which is great. Obviously, a great minds think alike. There's some overlap there, which is really, really good. But we want the guide to inspire housing providers, architects, designers, builders, and commissioners and regulators. But a lot of these things can be done by the occupant themselves, either themselves or with the help of their friends and family. And the document has been developed in response to the recommendation 34 of the APPG, which we mentioned at the beginning of the talk. So next slide, please. So we know that the physical environment that people live in can benefit or negatively impact on someone's experience if they're living with dementia. We know that, aside from memory loss, dementia can affect people in different ways, in their behaviour, how they see, smell and touch items, how they manage and organise everyday life, and how they organise everyday living. So this isn't just about memory. This is about senses, it's about experience, and it's about routine in many ways. If people help to maintain their routine, then we hope they can help to live in their homes for longer. Next slide, please. So what we'll do now is, rather than go through the guide page by page, because it is available on the HousingLIN website, I've just sort of picked up some sort of main points that and the approach the guide's taken. So we basically go through each room of the house, give an example of a typical bathroom, a typical kitchen, and a typical living room and bedroom, and point out some of the things that have been done different or better that can help somebody. So on the first slide here, we're looking at the bathroom, a fairly routine, regular bathroom. Point out some of the things that can help. So they might not always look great, but a contrasting coloured loo seat can help somebody with visual recognition issues, help clearly see where the loo is and that it is indeed a loo. Things like a mat, as I mentioned, a mat can be quite disorientating for some people with dementia. It can either look like a hole in the ground or a puddle, considering a trip hazard. So if not needed, then avoid things that can cause problems in that respect. Make sure taps are easy to use. Make sure the shower head, the power in the shower isn't too powerful and therefore not startling for the resident. If that's something that might upset them in some way. There's some ideas of assistive technology that can be used as well in the bathroom to help avoid floods and incidents and issues that can cause. And then things like grab rails, again, a bit like the toilet seat, make sure that's a prominent colour to help it stand out. One of the things we know from our customers at Irwell Valley is that mirrors can sometimes cause disorientation or confusion. So if a mirror isn't needed, then could it be removed? It's a simple thing to do that can help somebody. Next slide, please. Then moving through to the kitchen. Again, basic design of the kitchen. You can't necessarily always change everything in a kitchen. If you're a social housing tenant, you might be stuck with the kitchen you've got, but certain things can help. Labels on drawers, handles that are easier to grab, switches that are highlighted so that there's a contrast between the switch panel and the wall behind it can help somebody see where the light switch is more easily. In our dementia specialist service, we have glass fronted cupboards, so customers can see into the cupboards straight away. They can see that that's where the plates and the cups and the glasses are. There's not that sort of sense of what is behind that cupboard door, and then there's not that natural prompt that somebody would benefit from. And then likewise, there's also technology that can be used in the kitchen that can help people. They can be remotely monitored. We have found that when we were weighing up the pros and cons of whether we fitted electric hobs or gas hobs in our dementia service, in one hand, there's a greater risk of burns from an electric hob. Then there's also a greater risk of gas leaks. We've decided, and so far it's been borne out in experiences, has been absolutely fine. More customers were more used to using gas hobs in their own home before they moved into the scheme. Therefore, we wanted to fit gas hobs. So therefore, we fitted gas sensors above each hob, just a small unit that sits above by the extractor fan that will cut the gas off if there's gas leak, if the gas is left on. So, you're getting the best of both worlds there. People are familiar with the technology they're using, but there's a safety net in place. Next slide, please. Again, we look at the lounge. A conventional lounge are the things that are going to be disorientating or confusing. Again, rugs and trip hazards, mirrors can be an issue. Is there a clock that clearly tells you not necessarily just the time, but whether it's the morning or the afternoon or evening? Are there paintings and photographs that remind and jog memories and happy memories for the resident in the room? Is the lighting bright enough, as Joanne said? Sometimes buildings are defined as their design, but we can improve the lighting of the curtains, lighter colour so they let more daylight in and not blocking half the window. Simple things that you can change that can help improve circumstances. Next slide, please. Again, then we move to the bedroom. Various assistive technologies that can be used, fall detection technology that can help if somebody has an accident during the night, if they're going to use the bathroom. Is the bathroom within eyesight of the bedroom? So there's again a memory prompt there. Think about blackout curtains, if that can help with setting a good sleep routine, especially if you've got an east-facing bedroom, so the sun's not blazing in first thing in the morning in the summer. Is it helping maintain that good sleep and that good routine? Next slide. And then the garden. Again, you know, is the garden accessible? Is it level access? Does it promote a positive environment? Gardens are, again, something that we can't always change, but if you've got the space and the opportunity to do it, can it be designed in a safer way? If your resident has really enjoyed gardening all their lives, you know, can you fit raised beds that can help them maintain gardening still? Can you use plants that remind them of things they had either in their previous home or when they were an active gardener themselves? Help maintain that routine and that enjoyment of being outdoors. Again, if there's space, try to have paths that sort of continue in a loop in some way rather than a dead end, so that a resident who might be wants to exercise or might get disorientated doesn't have those sort of dead ends and those blockages. So just make that sort of garden flow as best as you can, and make sure there's clear sight lines back into the home, and that the door into the garden is clear and visible, so that there's an obvious connection back into the indoors again when the resident's ready to come back home again. So they were the kind of the main areas we looked at in the design guide. The design guide then goes on to talk about assistive technology that's available in the home, and then lots of advice and guidance on websites that people can go to for further information and advice. I think that's the last slide. Next slide. Yep, I think it is. So all that information can be found on the HousingLIN website, along with vast amounts of other information about dementia-friendly housing. And please, when you see the document, please share it with your networks and contacts. We really want to get these documents out there into the industry, so that people are considering it when they're giving advice to customers, and when they're designing homes from scratch, or when they're modernising and carrying out refurbishment programmes, sheltered housing schemes. It's some really sound, simple, cost-effective advice that can really benefit people. Thank you.
Brilliant. Thank you, Andrew. Really inspired to go through room by room. I think you can really picture how you can do that in really small, effective chunks. So just one quick question from me is, there was a lot of ideas there and shared in the design guide. Is there one area or idea that stands out to you?
I think from the research we've done and the feedback from our own customers, the one thing that can really benefit is the use of things like smart speakers, Alexa, things like that. The possibilities that can offer. I mean, it's designed for people that choose to ask to have their light switches turned on and off, rather than pressing the button themselves. But if you've got mobility issues and memory and support issues in that respect, simple things like having the lights coming on and off pre-programmed to be done. If you've got someone, you know, if you've got the technology to do that, can really help. Things like turning the curtains, closing the curtains, things like controlling the heating so it cools down slightly in the evening. All those things can be done through Alexa. And there's, you know, it wasn't necessarily designed to support people with dementia or mobility issues, but actually a really positive benefit from that is that they do. And with a bit of assistance, a bit of technology, you can really make a difference.
Brilliant. We'll see lots of claps and thumbs up there for you, Andrew. So that's brilliant.
Thank you.
I'll keep us moving along, seeing as our time is precious today. And I'd like to introduce our next speaker, Mary Marshall, who is Professor Emeritus at University of Stirling. And Mary is going to be talking to us about enabling toilet design for people with dementia. So over to you, Mary.
Oh, sorry, Mary, to interrupt. I think your microphone might be off, unless that's just me.
How pathetic.
Oh,
right,
brilliant.
okay, I'll start again.
Don't worry.
I was only saying that I could go on about toilets till you're all blue in the face, but I won't, and I'll restrict myself to my time and some key points. But I did offer to do a comedy slot with some of the truly shocking and disabling photographs I've got of toilets that are people with dementia are expected to use. Can I have the next slide, please? That's the why I've written short there. Next one, please. I'm going to make one key point, given that I've got limited time, and it's one I think that's the most challenging, that the focus should be on the detail. Thank you. If you want to go on. So what defines an enabling toilet? One that's easy to find. What I should point out is that most people with dementia are old, so issues like urgency in finding a toilet are very important. one that's easy to use. So when you actually do find it and get there, it's easy and you're safe using it and you're not going to fall or get upset. And I find myself constantly emphasizing this complex combination of aging and dementia. I think people go on a lot about designing for dementia without fully appreciating that it's the combination of aging and dementia that's so very challenging in design terms. And of course, all of this applies to new build and adaptations. Next slide, please. So why is getting it right so rare? And I think one of the things is a lack of knowledge and empathy about the serious consequences if toilets are not enabling. We did some research with people with dementia as our researchers, in that case looking at toilets on transport. And it wasn't just the physical problems, it was the terrible emotional toll of some of the disabling toilets for many of the folk with dementia. And you have to ask yourself how much distressed behaviour is actually resulting from toilets that are such a challenge to use by people with dementia. There's a general unwillingness to talk about toilets. When I give talks about it, there's always a titter goes around the room before I get going. And I do understand toilets are a private space and that people have all kinds of complicated feelings about toilets. And can I recommend a book by, if I can hold it up, Nick Haslam, called The Psychology in the Bathroom, full of wonderful quotes. Despite the importance, excretion is something that people rarely want to think about. Instead, we try to put the greatest possible physical and psychological distance between ourselves and our waste. It's very difficult to get people to focus on toilets. There's an issue of constant innovation in design of sanitary ware. And I'm really not sure why this is. And I do slightly wonder whether it's about pretending that toilets are not about defecation and urination. But the consequences of this are dire for many people with dementia in terms of understanding how to use things. Suppliers, installers and plumbers are rarely sufficiently knowledgeable. It is a bit better than it used to be. You do see more coloured toilet seats. But if you look at the suppliers' websites, even now today, which I did, you'll find all kinds of unhelpful things like they don't fully understand what contrast means. So you get a pale blue wall behind the toilet, which means that for the aging eye, the toilet is invisible. There's a lot of work and it's very encouraging because I suspect a lot of them are listening to this seminar. Can we have another slide, please? The one before, please. We've jumped one. Finding the toilet, obviously visible from all rooms, is problematic. If you're designing a flat just for people with dementia, you can do open plan and make the 2 doors to the bathroom and 1 off the open plan room. And if it's en suite, it can be visible from the bed. There's an issue about doors in the hall being the same. And some people, one architect I knew put different mouldings, which was too subtle by half. Others use colour, but don't make the colour strong enough. I favour putting some glass panelling in the door, but it'd be interesting to talk about that. And the simplest and one of the most effective things you can do is make sure there's a low light above the sink that can be left on at night. Next slide, please. I'm racing a bit, I realise. Using the toilet, the whole issue of contrast. White sanitary ware must contrast with the wall to be visible to the aging eye. And consider diminished muscle strength. You lose your muscle strength at the rate of 1% a year from the age of 25. So when you get really old, it's highly problematic. And there's a wonderfully cozy term now called comfort height toilets. And they're a huge help for many older people. But it's rather unclear what that means. And older people come in different heights, and you need to make sure you get the right height for them to get off it. But the consequences of not doing it are horrendous, with people who don't understand that the toilet is too low, and sit on it and get stuck on it, or grab the sink and the sink comes away from the wall. It's a really key issue not sufficiently thought about. Next, please. And I've just got 3 examples to show you what I mean by detail. The one on the left, most people, I think, could work out that you turn those white things, though some people might try pressing them. But what if you've got wet and soapy hands? Those of us without dementia will know to grab the towel and use that. People with dementia could well be completely flummoxed and upset and stuck. It's also impossible to know which is hot and which is cold. The one on the right was one in some self-catering I was recently in, designed for people with disabilities, and even had a pious sign about invisible disabilities and being considerate of them, including dementia. And then they produce a wonderfully complicated tap like this. You actually pull those levers forward, but a lot of people wouldn't understand that. I once sat with a man with dementia and watched him using a tap, and he pushed and pushed and pushed, and it didn't work, and he hit it and he tried to lift it, and then he burst into tears. We really must get sanitary wear that makes sense. And the plug here is extraordinarily difficult to understand. You pull it up at the back. Next, please, and my final slide, which is, I'm embarrassed to say, a sink in my dementia-friendly bathroom. So I've got everything right, except the plug. The plug requires a remarkable degree of muscle to push it down if you understand that that's how you work it. A really big blunder on my part. If you want a lot more detail, I've put free download details on this slide where you can get me at much greater length. Thank you. Sorry, that was a rush.
Don't worry, Mary, that's really, really interesting. We can see lots of comments coming through about adjustable toilets. And actually, I think Shauna has said that we love talking about toilets and they're very, very complex, which you would never think of before. Can I ask you just briefly to say a few more words on your point about designing for a complex combination?
Yes, I think people don't always take into account things like the aging eye, which requires twice the amount of light. Though, I mean, obviously the speakers today have twice the light and a contrast of at least 30 LRV if we are to see, us oldies are to see things properly. Or this business of diminishing muscle, but things like those flush buttons in the wall that require you to push very hard, or the ones at the side of systems where you have to push awkwardly, are extraordinarily difficult for people with poor muscles. And if you aren't able to understand them as well, it's a double whammy, and you are then totally disabled by the equipment that's provided.
Brilliant. That's an excellent point. Thank you ever so much for that. Just before I move us on, just to let attendees know that the slides for this session are available on the website, and not to forget to put your questions in the Q&A if you have any for our panel at the end. With that, I'll move us on to Debbie Carroll. So Debbie's director at Step Change Design, and she's going to talk to us about dementia-friendly gardens. Thank you, Debbie.
Thank you, Pam. Yes, so as Pam says, I'm Debbie Carroll from Step Change Design. I'm a garden designer by training, and with a fellow designer, Mark Rendell, undertook a research project to understand why care home gardens, particularly for dementia, were not used more actively, even when designed to the latest design guidance. And although I'm going to talk about care homes, all of the findings that we came up with actually do translate to the home setting as well, and to wider organisational settings too. So forgive me if I refer to care settings throughout. Next slide, please. So why don't we go into the garden? Our research took us far and wide and deep into our care homes that we worked with, 24 across England and Wales, before we eventually found our way back to our designer roots. And the overarching finding that surprised Mark and I was that there was a direct correlation between advanced care culture practices, so person-centred care and beyond, and truly active engagement outside. And that in these settings that were practicing truly person-centred care, engagement happened regardless of the condition, appearance or design of the space or the time of year. We also identified that where organisations had fearful attitudes, or carers even in domestic settings, had fearful attitudes around health and safety, it would effectively cap engagement outside, and that this actually has to be overcome and addressed if actually the outside space is going to be used in any shape or form. And where a garden is potentially going to be redeveloped, obviously that it's important to not end up with a garden falling out of use quickly after the novelty has worn off, and that's what spurred our project. It took us some time in our study to identify where designers fitted in, and that was very much around the fact that the design support needed to support the care setting or the organisation or the carers where they are currently, and to help them on a journey towards more person-centred care, so that that would lead to the engagement outside. And so person-centred care is the facilitator to greater engagement, on which any design can be supportive. Next slide, please. So I'm just going to share a few quick areas that you could go away and have a look at, whether it be in a care organisation or in a domestic setting, that are some quick wins, or that might help you if you're planning changes to the garden, that could help you be more articulate in what you really need, rather than perhaps what you think you might want initially. So the first thing is really to take a fresh look outside, but start that deep inside your building. Very often doors and windows are that main connection to the outside. And for people with dementia, they very much need to see the garden for it to exist sometimes. And so check whether the routes are clear to get to doors, particularly for people who may have mobility issues. Are they wide enough and clear enough and clutter-free for someone to be on an arm, or for mobility aids? Are the doors open, unlocked? Most care settings have secure gardens already, so complicated systems at doorways are often an indicator of a fearful health and safety practice that needs to be unlocked. But equally, I've been to homes where, for example, this push pad sign was on a door that was open. It was the main door to the garden, but the signage made you wonder what was going to happen when you used that door. Was some alarm going to go off? Was this the genuine route outside? So is it clear for people with dementia what is the route in and back out and back in for them? Likewise, at windows, you know, can they see out easily? Can they get to windows? Within care environments, are the chairs all facing inwards? Within one setting, we turned 6 chairs around, and within 24 hours, there was greater engagement, simply because the people living with dementia could actually see the garden. And for one lady in particular, within 48 hours, it improved her sleep and her mood, simply by moving 6 chairs to face the outside. Next slide, please. So what's on your wish list? If you're planning changes to your garden, it's quite easy to present designers with a lovely wish list. And in one care setting, we were presented with a lovely list of about £20,000 to £30,000 worth of items that they thought would help the garden be more actively used. The garden door was locked, and when we investigated why, it transpired that there was a lack of a handrail at a single step at the doorway. Guess what was not on the wish list? The handrail. And this is what we often find. We need to do a sense check. Why are you not using the space you already have? And are the reasons for that properly investigated? And actually, if there are missing items, are they truly on your wish list? It is rare that the garden is truly to blame. Very often it is us as the people involved in supporting people with dementia that actually get in the way, and that our fears may actually hinder that engagement. Within the space, also keeping it familiar and domestic. If we're creating spaces and it's meant to look like a front or a back garden, it needs to look like a front or back garden. Avoid the gimmicks and things that might add to confusion. Take care about conceptualizing, particularly sort of more abstract themes that perhaps are hard to interpret. It needs to be easily read for what it is. Include items and elements that actually the person can relate to, but keep them flexible. People through the course of their day and their dementia journey may change in what they do want to engage with and don't. And so you need to be able to evolve that over time. And for care settings, the mix and change of residents also will mean needing to change that long after a designer may have left. So keep it flexible. Take care with sensory gardens. I love the phrase, and we all love to use our senses. But for some people with dementia, they don't want overstimulation either. So it is about knowing the individuals. And actually just stepping outside is a sensory environment. It's different from inside and can be quite powerful in its own right. So take care to what you add. Like I say, keep it domestic and familiar. Next slide, please. So people often ask, what should we add in the garden? And we did look at what things people engaged with in our study, and there were 304. So variety was clearly the spice of life. There is no one big win, unfortunately, but some areas that did stand out, and on our infographic that is available from our website, we found that seating improved and extended visits by 20%. Surprising number of settings don't have enough seating or any seating. If you take a meal or a drink outside, people will stay 80% longer. If someone joins the person with dementia, they'll stay 31% longer. But again, we come back to flexibility. Things need to be able to be evolved and changed. Next slide, please. So there is further resources and support on our download page of our website. We've written so many articles for both the care sector and design sector. Plus we have 2 books in a series called Why Don't We Go Into the Garden? A detailed care culture map tool that is for care setting to help them on a journey to person-centred care, and a designer handbook to help understand the role of organisational culture on applying your designer skills, as well as workshops and site-specific consultations. We do some limited design now, but actually it's more often that I work alongside care homes, audit their designers to help understand the most appropriate application of support alongside that journey to person-centred care and greater engagement. But even in a domestic setting, the person caring for someone with dementia can also influence the way that a garden is used. So many of the things are translatable. Next slide, please. And if you want to keep in touch, here's my details. Thank you.
Oh, that was absolutely brilliant, Debbie. Thank you. I know you said there about variety and things perhaps not standing out just as a single thing, but can I ask you, was there a key aspect or element that you think makes a successful dementia garden?
Yeah, it is very much about knowing the person living with the dementia. And so we came up with what we call a checklist tool, or I affectionately call it my anti-gimmick tool. There's 4 questions. If you can answer them with a yes, it's more likely to be a suitable activity or a suitable element to add. So is it purposeful? Is it realistic and in context, so you'd expect to find it there? Is it relevant and meaningful for that individual or that group of people? And finally, does it allow a sequence of events? So it might be that you grow some seeds of flowers, but that they can be picked, and for somebody else, they might do flower arranging. So there's a knock-on benefit from an activity or an element. So if those 4 questions can be answered with a yes, it's probably a really powerful thing to add, but be prepared to change and be flexible.
Oh, that's brilliant. Thank you ever so much for that, Debbie. So I'm going to move us on. We are running behind, but this is all just so brilliant. I'm just going with it at this point. So next to talk to us about bespoke dementia-friendly environmental assessment tools, Jennifer Bray, who's a research assistant at the Association for Dementia Studies, University of Worcester. So over to you, Jennifer.
Yeah, I'm Jennifer. I'm here on behalf of Sarah Waller, who was unable to make it today, and I'm going to talk about the environmental assessment tools that we currently offer. So next slide, please. And I wanted to start by thinking about why it's important for us to do assessments. And one key reason is that often we think that we know our own environments and we know what's going on there. But actually, if we carry out assessments, it can offer us a different perspective, especially if we involve others in that assessment process. So, for example, if it's in a care home, getting other staff members and also the residents involved to see things from their perspective and help us identify things that maybe we aren't recognising as problems. It helps us identify where we might need to spend a bit more time and effort to make those improvements. And as we've heard today, even small changes that we make within the environment can actually make such a big difference. So it's helping us to prioritise and see where we can put our efforts to make those differences. And by carrying out assessments, and and taking other people along with us as part of that assessment process, it can actually help to get better buy-in from people at different levels, so management levels, and educate other colleagues and staff members and help to change people's attitudes, because we can develop that shared understanding of what needs to be changed within an environment and why those changes need to be made. And maybe if there's working practices around the physical environment that we can also address at the same time. And a key element is that when we talk about assessments, we're not talking about a one-time event. It's something that we can do at different times over a period of time as we're making changes. So it helps us to see where we're starting from and then record those changes over time and hopefully see the progress that we're making. Next slide, please. So the enhancing the healing environment assessment tools is a mouthful to say, but they were originally developed by the King's Fund, and at the Association for Dementia Studies, we took those over and refreshed and revised them, and also added a garden version. So now they cover 6 care environments that you can see on the screen. The tools are evidence-based, and they all use the same 7 criteria, which we know are aspects linking back to a lot of the things that we've already heard today, areas of the physical environment that we know are important to people living with dementia. Mary, you'll be pleased to see that toilets do come under the continence and independence section. So we are very much talking about toilets in these. And we are proud to say that they remain free to download in PDF formats for all 6 care environments, and they will remain free as far as we have any say in that. Next slide, please. But one development that has come about fairly recently is that we've been very pleased to develop an app version of the tools. That's thanks to funding from Betsy Cadwallader University Health Board in Wales, and it's something they've been hoping to do for ages, so we're very pleased that that's been possible. Key features of the app is that they do work on any device, so whether you've got an iPad, an Android phone, a laptop, anything like that, we've tested it on all of those, and it works regardless of what you're using. Again, they remain free to download, and they are available in both English and Welsh, so you can choose which version you want. And rather than having to sort of download a separate one depending on your care environment, the app covers everything. So you can download the app once, and you can maybe carry out multiple assessments using the care home version or the housing version, or you can do different assessments in different care environments depending on what you're doing at the time. And one important thing that we recognised is that many health and care organisations and settings can have limited access to Wi-Fi connections. So once you've downloaded the app itself, you don't need to remain connected to Wi-Fi. So you can take it out into the garden and do your garden assessment and not worry about being connected back to the care home or the housing scheme. And any results that you input into the app remain on the device. They're not shared anywhere. It's up to you to decide what you want to do with that. And they are using a very similar format to the original tools. So if we move on to the next slide, I'll show how that works. So at the top, we've got one of the pages from the PDF, and down the bottom, we've got some screenshots from the app. And as you can see, both have a rationale where it explains why that particular criteria is important for people with dementia and why we need to be thinking about some of the areas that have been talked about today. And we find that these have been quite a useful learning tool to help people not just go, we must do this, but actually understand why and what the reasoning is behind it. Both the PDF and the app version have a set of self-assessment statements that you can say how well you're doing on a scale of 1 to 5. And they also have spaces for you to add notes. So maybe something that you particularly want to capture about something that, you know, it could be something you're doing really well or something that you think, actually, this is a priority for us. So you can make notes against it in both versions. And next slide, please. And an extra bit that we've been able to develop as part of the app the app automatically generates a summary sheet of your assessment, which you probably can't see very well on the slide, I'm afraid. But you can export that summary in either a PDF format or a CSV file, which you can then open in Excel. And we've created a comparison spreadsheet for each care setting. So it enables you to upload different assessments. So maybe if you work across different care homes, here the example on the screen shows multiple wards. So you can compare how you're doing in different wards and maybe see which, if you've got particular good practice in one area, what are they doing well, and how can we share that with other areas? So it helps you to see what's going on. And this isn't just limited to the app. The spreadsheets are separate from the app. So if you have done an assessment on the PDF paper version, you can manually type your answers into the spreadsheet and still make use of that comparison functionality. So next slide, please. And everything is free to download from our website. So the original PDF copies, they're all free to download. There's a link to the app, and you can choose whether to download it in English or Welsh. And all of the comparison spreadsheets are available via the website. And we've also created some short how-to videos to help people to understand how they can download the app and how to get started with it, because not everyone's going to be familiar with the technology around an app. So we just sort of thought it might be useful to help people know where to get started. That's a quick race through the environmental assessment tools, but hopefully gets you a bit back on track, Pam.
That's brilliant, thank you, and I do appreciate it. That's brilliant. If I can ask one just follow on, could you just summarise what are the main advantages of carrying out an assessment?
Well, I think for me it's that we don't necessarily see what's around us every day. So like we can walk past the same things and not notice when it might be an issue, because sometimes if it's not a problem for us, we don't necessarily realize how it could potentially be a problem for someone else. So undertaking an assessment, it kind of makes you look at things that you wouldn't necessarily notice on that day-to-day basis. And also I think, I mean, we've heard today of all the brilliant things, the changes that you can make and things you should be looking out for. But sometimes that can feel a bit overwhelming and sort of like, okay, I know that I need to make changes, but there's so many and I don't know where to start. So if you do an assessment, it can allow you to see, well, actually, I'm not doing too badly in this particular area. So, you know, there might be a couple of quick wins that we can do just to get the ball rolling, or actually, this is a big problem for us. So this is where we should be prioritizing. So I think for me, it's the main advantage is being able to see what you're not seeing and knowing where to start.
Sounds like good advice to us all, Jennifer. Thank you ever so much for that. Okay, I shall move us on to Jeremy Porteous. So Jeremy's the Chief Executive of HousingLIN. And Jeremy, you're going to talk to us about the Older People's Housing Task Force. Thank you.
Thanks, Pam, and thanks everybody for fantastic presentations so far. I don't have a set of slides for you, and I'm going to weave together some of the things we've heard already this afternoon and relate it to the Older Persons Housing Task Force, a task force that I was privileged to sit on, which was chaired by Professor Julian Mayer, who many of you will know has a long history in gerontology in particular and care. But I also want to give full credit to one of our delegates, Ruth Ely, because actually without her leadership and some of the work back in the tail end of the Labour government, we wouldn't have had the first ever national dementia strategy, Living Well with Dementia. And it recognised not just the need to look at the integration between health and social care, but also looking at issues around the person-centeredness, as well as the support through a variety of both planned care as well as the role of carers as well. We haven't really touched on carers too much this afternoon. And at the tail end of the Labour government, and obviously with this week with a new government, it'd be interesting to see how much further we can take that strategy on, since a number of reports and documents and policies that have taken place over the intervening 15 years, including the Prime Minister's Dementia Challenge. And that dementia challenge was very much around thinking about post-diagnostics, thinking about the interface between health and social care pathways, and the role of housing, the way we design our homes and our communities, was really not an afterthought, but something that needed to be sort of escalated and championed far more. And the work of Alzheimer's Society developing the dementia environment checklist, and then followed by the all-party parliamentary group report, Are We Ready? Designing housing for people with dementia, a copy of the report that Joanne referred to in her opening presentation, really started to think and tease out what we want to explore around designing our future homes. And a full credit again to Katie Twyford, the co-author of that report. But coming up to the Older Persons Task Force, there's some other sort of key documents, and it follows on from Jennifer's presentation quite nicely, and the work that Becky and Teresa have done at University of Worcester called the DEMEC project, looking at the role of dementia and in relation to housing with care, extra care housing, and seeing it not just in terms of the design of the built environment, but the way we do commission, how we manage, and how we engage and involve and co-produce with older people, with people with dementia, living with dementia, and their carers. And there are 3 fantastic insight booklets that are available on the LIN website, which are very much worth reading. And that really has helped inform some of the policy and practice to underpin some of the work of the task force. The task force was established back in May of last year and reported the day that the election was announced. Now, that is significant because it means that the government will need to respond to the task force's recommendations, albeit that the incoming government is a different one to the one that originally commissioned the task force on older people's housing. That was undertaken by the Department of Levelling Up and Communities and Department of Health and Social Care. So again, a joint approach to thinking strategically, what is it that we need to think about in relation to our future housing, not just in terms of specialist housing and purpose-built housing for older people and people in later life, but also how we adapt and improve our existing stock to make sure that it is age-friendly, and critically for our conversation this afternoon, recognising right from the outset the dementia inclusivity as well. And that was partly led by Professor Judith Phillips, who many of you will know at University of Stirling, and Mary's link with the University of Stirling's Dementia Development Centre. And that has come through the work of the task force. And while the final report is not in the public domain, I think it'll be fair to say that it is dementia ready. It also touches on a number of things that it sees as important triggers for looking at future leadership, investment, partnership working, and critically awareness raising, so that we have a sector that can respond much better than it has over the last 10, 15 years and take forward the HAPPI recommendations from the Are We Ready report that Lord Best commissioned back in 2021. A little bit more about the task force. It really looked at 3 key areas. One was around thinking about what is it that people need, want, aspire to in later life. And having made information, advice, and make access to decision-making tools a critical part of that, then looked at the types of products and places that we all want to live in, looking both in terms of design quality that we've heard about today, but also the communities that we want to live in. And I think dementia-friendly environments, dementia-friendly communities may be something, again, that we need to build in to an incoming government. It draws on the Deshkar project that Mary referred to, the design for a healthy cognitive aging, but also some other work called the Inclusive Living Toolkit as well, another piece of work that's being developed by University of Stirling and the Inclusive Living Alliance. And these are really groundbreaking guides, reports, research. And I think the task force will use, we hope that the task force report will land well with the incoming government. And I think the comments already through from the first few hours and days of the new Labour government suggest that there will be a new contract around what care should be and how it's funded in time, locally and nationally. There's a greater emphasis on revisiting some of the 1950s Newtown approaches. What are going to be the 2024, 25 plus housing healthy new towns, that environmental impact, how we can create using the design as well as the broader environmental tools that we heard from Jennifer to shape what the design might be. And I think the other thing is about wanting to invest in affordable homes, something that the task force really saw as critical in terms of providing a greater mix of housing choices for people in later life, including for people with dementia. But I think I want to sort of leave you with one or two final points. There's some great work happening at a local level already. Please have a look at things like the Greater Manchester Council's dementia strategy. The work that Joanne talked about, that Tracy Braben is leading across West Yorkshire. I think that regional imprint will make a significant, important way forward. But I also think it's making sure that we move from a medical model of dementia to one that looks at the social and looks at the broader architecture as well. So that's why I'm really keen that the work of the task force will not just die as a result of a new government, but something that we can inform and influence the new government taking forward. Thanks, Pam.
Brilliant, Jeremy. Thank you. Very changeable times. Can I ask you, how can this group work effectively with the new government? Do you have any insight into that at all?
This is personal insight than any professional insight, Pam, but I mentioned that the task force was commissioned by the DLUG and DHSC. The two junior ministers, Stephen Kinnock at DHSC and Penny Cook at DLUG, I think are going to be responding to this. It's also interesting to note that Stephen's mother, Glynis Kinnock, the late Glynis Kinnock, also had dementia. So I'm sure his personal insight and his understanding as a family may well be something that we can work with and work and support him, develop a national policy and a programme to support the housing contributions that it can make.
That's brilliant, and some lovely comments coming through there, particularly from Ruth, who's saying great opportunities ahead and feeling optimistic is unfamiliar. So I think that sums it up. That's really brilliant. Thank you very much for that, Jeremy. I will move us on now to Vanessa Pritchard-Wilkes. So Vanessa is the chair of the DHWG, and I also have the privilege of working with Vanessa at Housing 21, where she is the head of strategic operations. So over to you, Vanessa, to give us an update for the DHWG.
Thank you, Pam. So could I have the next slide, please? So as Pam said, I'm the chair of the Dementia and Housing Working Group, and I've had that pleasure for about 5-6 years now. The terms of reference do say that it's supposed to change every year, but it's not for some reason, so I carry on. I just want to sort of echo the positive sentiments that Pam gave to Wendy Mitchell earlier. I had the pleasure of meeting her. We had a live dementia diary session at one of our schemes, and she was absolutely inspirational lady. And just a big shout out then to Dementia Diaries. It's really a really great resource to understand how people living with dementia respond to certain situations, and it is really quite insightful, covering a range of topics if you haven't looked at that site. So we decided to relaunch the Dementia and Housing Working Group last year with a focused work plan and a new strapline, which is information, insight and influence. We believe that this group is needed to really increase the understanding of dementia-friendly housing standards, to really think about and try and influence those inadequate conversations around housing options that people receive post-diagnosis. And also there is a limited dementia training programme for housing professionals, and indeed there's been some movement in the chat today around training for housing professionals. And there's actually no other national group that's talking about housing and dementia and taking this agenda forward. So we're really we're really keen that this conversation doesn't slip backwards, and I think especially as the Alzheimer's Society has actually dropped housing as one of their strategic priorities. So the overall aim of the group is to promote and influence the contribution of the housing sector to improve the health, well-being and quality of life of people living with dementia. And there's just a few of the members represented on this slide here. So the group is made up of networks and organisations who have an interest in housing and dementia. Next slide, please. So in order to meet our aims of providing the information and insight to influence the work around housing, we've worked on a number of resources over recent years. So the one on the left there, the Dementia Friendly Housing Guide, was a key deliverable of the Prime Minister's Challenge on Dementia, which was back in 2020 and a few Prime Ministers ago now. We're currently talking to the Alzheimer's Society to take back ownership of that. Housing 21 actually co-authored that with the Alzheimer's Society, but we think it's important that this group can have oversight of it and update it where necessary. And actually the idea for these sessions came from when we were doing the evaluation of the Dementia Friendly Housing Guide, and it quickly became clear that people thought it was an older person's housing provider issue, and it's not. It's a housing issue which we all need to rise to. So the guide is aimed at the whole of the housing sector, from initial planning through to retrofitting, and the housing sector in its broadest sense, so not just social housing, and a whole range of occupations within it, from architects, planning, etc. And as has been said earlier in this webinar, it recognises the fact that most people don't live in specialist accommodation, so we really need to make our general needs and our own homes more dementia friendly. And we did involve people living with dementia in pulling together this guide, and it's built around the 3 areas of people, processes and place. So there's key actions in there that can be taken. There's case studies within there, and what we aim to do is actually put information and actions in there. So irrespective of the size or the maturity of an organisation, there would be something that they could do to help people live well with dementia. And has been said on numerous occasions this afternoon, that is available for download from the HousingLIN website. The APPG report on housing and dementia has already been mentioned, and as a group we really took this as providing us with some guidance as to what resources we should start to develop. The inquiry gave us 44 recommendations, and as a group we've taken up sort of 4 or 5 of those. So the inquiry makes strategic policy and investment recommendations, central and local government, provides practical advice for homes, and references the 10 original HAPPI design principles and has dementia proofed them. So as I say, we've responded to a number of those recommendations. You've heard about the design guide, which Andrew spoke about, and this is the official launch of that design guide. So thank you for everyone who worked on that. And Wendy, who is speaking after me, will talk about the Dementia Hub, which again was one of our responses to our recommendations. So our first speaker spoke about the dementia champion role, and so we've designed a role spec for that, again, which can be downloaded from the HousingLIN website. So that's for a senior member of staff to champion consideration of dementia in an organisational service. So we'll seek to continue to influence other groups. A recent group that's been set up in the past sort of month or so is a brighter future for people living with dementia, to start to advise local authorities, and the first meeting of that, which we've been invited to, is later this week. So the conversations are starting to happen more and more. Our future work will also focus on technology and how smart housing and assistive technology can help people live well with dementia at home. And we'll work to continue to influence the staff working in the housing sector to understand the needs of people living with dementia. We also want to develop a better understanding of inclusion and dementia, and to continue to try and influence policy across the housing, health and care sectors. So one of the main aims of these sessions was that everyone would have a takeaway. So I hope that wherever you're from, you've managed to so far come away with a takeaway, something that you can put in place in your services to provide a better service for people living with dementia to help them live well. And we're also really interested in finding out what other webinars we can put on that will provide information on the areas that you're interested in. So there will be an evaluation sheet after this. So if you do have any ideas, or pop them in the chat now. We are a group that are passionate about people living with dementia and making their lives better. And if that means doing something to actually increase the knowledge and awareness of certain aspects, then that's what we'd like to do. So thank you all for attending this seminar. Thank you.
Brilliant, thank you, Vanessa. And you'll see in the Q&A there is some feedback coming in about other sessions that you may want to put on, so that's there for you, so that's brilliant. Can I ask you though, how do people get involved in the group, Vanessa, if they wish to do that?
So you'll find some details on the HousingLIN website. So we have a page for the Dementia and Housing Working Group. You'll find the resources on there as well as terms of reference. But I'll pop my email address in the chat, and if people want to contact me directly, then I'll be more than happy to have a further conversation with them. And we would love to welcome new members to help us progress our work.
Brilliant. Thank you very much for that, Vanessa. I'll move us on to our last speaker, Wendy Wells, who is the Head of Agency Managed Policy and Business Implementation at the Guinness Partnership. And I think Wendy's going to very bravely share her screen and give us a demo of the Dementia Hub. So over to you, Wendy.
Thank you, Pam, and hello, everyone. Yeah, so I work for the Guinness Partnership. I'm the co-dementia lead with the HousingLIN, and I have sat alongside Vanessa on the Dementia Housing Working Group for some years, and I think she may have just been having a dig, because I certainly haven't volunteered my services as chairing it. But I worked on a project to make the Guinness Partnership more dementia friendly about 5 or 6 years ago, and that was a 2-year project. But what I've been focusing on is looking at creating a Dementia Housing Working Group hub, so a dementia hub for everyone. So if we could just move the slide on, please, Sally. Thank you. So out of the APPG, there was a recommendation about creating the best information, advice and support for people living with dementia, their families, carers, as well as kind of policy makers, practitioners and academics. So what we've done is we've created a hub, which we will be giving a shout out today to you all to help us populate. And it covers all of the areas that we have listed on this slide. So what we've tried to do is sort of put everything in one place so that actually, you know, it's easier for people to go to and find. So we are talking about things like research papers or design good practice, but as well as some support groups that might be in local areas or communication tools, financial support, care providers, adaptations, all sorts of things. So if you want to move on, Sally, why we created it. So there was so much information out there, or there is so much information out there, but it's all really dispersed and it was very hard to find. So the HousingLIN website is a fantastic resource, and we host the link to it on there. But actually there's just so much stuff out there that we wanted to be able to put it in one place and have that kept up to date by everyone. So, excuse me, sorry. What we need though is that we need for it to be populated. So we don't just kind of want to have something that's there. We actually want it to be kept live and populated. So I'm just going to go back and hopefully take control of the screen and give you a little demo about how you could populate it for us. So let me just see what I can do. Thank you, Sally. So let's hope you can see my kind of pinky purpley screen. Yeah, okay, great. Thank you. Thumbs up. So this is a Dementia Information Hub, and we'll share the link in the chat. And like I say, it's hosted on the HousingLIN website. And the idea of this came from another local authority's mental health team, actually. And it's a bit like a virtual Rolodex. So just to demo it, we have some instructions at the start on how you could use it. But actually, essentially, what you do is you roll across. There's a roller down here, or you can use your fingers and you roll across to all the different topics that you may want to look at. So you may be a family member looking for some care. And what you then do is you go to the column and you just roll down. And you can click on the links and it will take you to different people's websites, or there may be other resources, there might be voice notes, there may be images, whatever is there. And what you can do is you can actually rate it. So you could rate a section once you've used it, you could add a comment to it. But actually, as you can see, this is all added by different people. So it isn't, you know, the responsibility of one organisation to do it. It's just somewhere to put, you know, lots of different useful tools. There are communication tools for people living with dementia. There's some fantastic guides from the Deep network around language, and you know, if you wanted to set a meeting up with people living with dementia, you know, some top tips there. And you can see that I've rated that a few years ago because we use that within my organisation, and you can kind of put notes for other people. We talk about post-diagnostic support, and then obviously support groups. And then there's a section here for feedback, you know, how you can feedback, how you can have your voices heard. And then we've also got some commercial providers section. So if people had a piece of technology, or if they had an innovation that they thought would be really useful, then we're happy that they pop it on the Padlet. You know, we're not saying that we've tested all of these things and that they're amazing. What we're saying is you can choose to go to these websites and use what you want to use. We have a section on technology, and there's obviously the TAPPI reports that have been done. And then Vanessa was referring to the board dementia champions. So we've got the specification here, and we've got a section here that's empty for integrated care systems or partnerships, and we can add sections to it. So if people want it to grow, it certainly can grow. And it's dead easy to add things to. So I suppose my call out today is there's over 100 of us on this call. If everyone's used or found something that's useful, then add it on here. I keep this up to date, and we take a look at it. So all you would need to do is you go along to the section that you want to do. So Vanessa referenced the Dementia Diaries. So you just go onto it. You can choose different attachment types. I'm just going to select a link just to show you. So you can click on a link and you just paste in your link from your web page. So I'm going to paste in the Dementia Diaries web page because it's an excellent resource. And you click here and you will see the resource comes up. You could write something about it if it's something that you've done in your organisation, or if it's something that you've used with a family member or a loved one or a friend, then obviously write something about it, and then you just hit publish. And what happens there is that will come through to me, and I will go on, I will have a look, I'll agree it, and it will go onto the Padlet, or sorry, the Dementia Information Hub, as we call it. And it's as simple as that, really. And like I say, what we're hoping is this grows and grows. So I'm just going to stop sharing my screen and hopefully go back. Yeah, so that was, I think, really all I wanted to say in terms of the Information Hub. Really, just the plea from me today is please add to it.
That's brilliant, Wendy. Thank you. Can I ask you, how do you keep it up to date?
Yeah, so it's just a bit of housekeeping at the moment. So I go in regularly and tend to just check that the links are still working. And that's why some of the comments you'll see are from me, because it might be that actually I've ended up kind of going down that rabbit hole of reading something and finding that it's an amazing resource. But obviously it just needs to be kept up to date. There's so much innovation going on, and we've seen that from today, but actually it'd be really great to have that in one place. So lots of people will say, oh, can you send me the link to this, or can you share that? Well, let's use the Information Hub as the go-to place. And like Vanessa says, we are the only group that are focusing on dementia and housing. So it's really important that that resource is populated and looked after by us.
Brilliant. That's really, you're getting lots of thumbs up there. So absolutely brilliant, Wendy. Thank you. And thank you to all of our speakers. That was all absolutely great. Now I'm going to try and keep track of some questions. I'm sure somebody will pipe in if I get them wrong. But I'm going to start with a question for Joanne, if that's all right, which is how could you roll out the criteria you were talking to us about to other tenures beyond social housing?
Yeah, well, we started with social housing because that's where, as a combined authority, we've obviously got the most influence. But as has been said many times this afternoon, most people with dementia don't live in social housing, most live in their own homes. So we have started to look at how to share this more widely and how planners in the private sector could potentially be influenced. My colleagues currently contacting all planning departments in West Yorkshire to discuss how they could incorporate criteria into their design codes and local plans. And I think there was a question that made reference to that in the chat this afternoon. We also host a developers forum that's aimed at private developers, and my colleague Helen, she presented there actually just this last Friday, so we've made some contacts there which we're following up. We obviously, we recognise that we're looking at this in the context of a massive shortage of housing, and planners probably won't want to put any barriers in the way of building new homes. But yeah, it's such an important issue, and one that we just need to keep raising awareness of and influence as widely as we possibly can.
Brilliant, thank you. I'm jumping around a little bit, but Debbie, there's a couple of questions for you. So how do you apply your work to new builds or communal facilities?
Yeah, so communal facilities are tricky because what we found was that sometimes if it's not clear that everybody can use it, it can put people off. So it is about, in the design phases, making sure that ownership of it doesn't accidentally prioritize one entry point into that space, excluding others. And so that needs a little bit of thought to begin with. Within actual care homes, that can be overcome through the people and the staff. In terms of new builds, it depends on whether the organisation who's going to run it is known. And so it's better to start with the simple bones of a new garden to make it usable. And that when the operator is in place, that wider, more detailed use is developed with that operator going forward, so that actually the input of the residents and the staff are all included.
Brilliant, thank you. And while we've got you, Debbie, I know you've helpfully put your details in, but Shauna was saying there's a proposal to introduce terraces, and what is your view and advice on that?
Yeah, anything that helps people be able to step outside easily and freely is great. I love them, though I always get nervous when I hear of dementia residents in care environments being popped on upper floors and not able to access the garden on a ground floor. So it shouldn't be at the expense of also addressing how easy it is to enable them to step into the real world at ground level as well in some way. But yeah, anything that allows us to get a breath of fresh air has to be good news.
Brilliant, thank you. I'm going to move on to Jeremy for a couple, if that's okay. So Mariette's asking, given we are about to see an expansion of house building, how far can planning departments promote and implement guidance and best practice in new build estates, care homes and extra care?
Well, I think planning departments are critical. I've seen a couple of questions around that. I think, first of all, at a national level, there is guidance and good practice written by the Town and Country Planning Association on planning for dementia-friendly communities. That's something that's on the LIN website too. And I think planning authorities will be very much working on creating their local plans, taking forward the national government and the targets that are being set for all new homes, and then identifying how that fits in at a local level. The critical thing is not just about the planning, but also making sure, I think as Joanne will know and others have commented on, the design codes that are also in there. And really now is the time to inform and influence those, because a lot of the national programs, so the Design for Healthy Living, are relatively silent. So something like the new design tool will be really helpful to guide those localities. And I've just picked up, I saw Marnie's also asked the question about the link to dementia and sight loss. There's some really good examples of that from a charity called the Pocklington Trust, who've written, again, some really useful guidance and tools to look at issues around dementia and sight loss and broader neurodiversity.
Brilliant, Jeremy. Thank you for picking that up. I wonder if you can help with this next question. Others may want to jump in, but it's a question about how do we ensure consistency and best practices shared and implemented across nations where housing is devolved? And further than that, all local authorities across the UK. Do you have any comment on that?
Oh, that's a really big question, but the DHWG is critical in being the fulcrum here. I was delighted that at the last meeting we invited the Scottish lead from the Chartered Institute of Housing to demonstrate work that they're doing. We equally have representatives here from Wales and Northern Ireland, so we need to make sure that, I think, in the longer run, we have a UK focus, not just an English focus. Personally, the other aspect, I suppose, is it's learning networks need to work collaboratively together. You know, we host a lot of materials, but we're dependent on partnering and engaging with a broad spectrum of agencies to make sure that we have the latest tools. I think the Padlet that Wendy's just described is a really great, easy to use, accessible format from information and access to resources. But the other important thing that comes out of things like today is the exchanging of ideas and research and that collaborative approach, which is and the evidence of what's working on the ground. So let's create a super network.
Super network, I love it. That's brilliant. Thank you, Jeremy. Vanessa, can I ask you, in all of the work that's been done, have you considered that people with dementia who are in rural communities might have different housing needs to those in urban areas? That's from Jane.
So it's not something that we've specifically looked at to date, but I have made a note of it on my notepad as the question came in. So we will look to see what we can do around that. And as I've recently moved to a rural area, then it's closer to my heart. So I will definitely put it on the work plan. We did have a rural housing community on the group who is they're no longer a member, but if there are any rural housing associations here, then it would be great to include you in the group with your perspective.
It's brilliant. And as mentioned before, Julie has put a comment in that we've talked a lot today about design, but there's actually such a wide range of topics we could talk to in those seminars. So I'm sure you'll be in touch, Vanessa, to talk about those. Another one, while I've got you, is there's a lot of helpful links going into the chat box, but can you recommend any staff training for dementia awareness?
So I think somebody put in the chat that Dementia Friends is a good place to start, and let's not forget it's not training, it's awareness raising. They're very clear about that. It is very much a starting point. It's great. We aim to have 50% of our residents go through the Dementia Friends initiative, and it does give some real insight, and it helps to build empathy amongst people. So that's a good starting point. In terms of other training, there's not something I can recommend at the moment, but again, it's something that the group can look at. And I know as an organisation we do offer more enhanced training, so I can sort of come back with a response as to what training provider we work with. We do quite a lot of work with Skills for Care as well, so they may have some specific training, but that's one I can come back with a response to.
Brilliant. Thank you, Vanessa. Mary, we're getting quite a flurry of questions for you. So if I can start them off. What would be your priority adaptation if resources were very, very limited? What would you go for?
I'd double the level of lighting, and
Yeah.
I would make sure that there was proper contrast with all the sanitary ware, maybe with a dark coloured dado behind the sanitary ware, rather than these timid pastel shades that are always favoured.
Brilliant, great answer. And then there's a couple of others have come in. So Julie was asking, does a height adjustable toilet exist? And then further in the chat it said, yes, there was one, but on Google search it was very expensive, between £1,500 and £3,500. Do you have any comment on that? Or it was more of an observation, but that's very expensive.
On the whole, yes, it is. And most people won't be able to afford it. And I think people should be aiming at comfort toilets rather than regular toilets on the whole. Now, there are very small people who will find them too high, but on the whole, that's helpful to everyone and stops people getting panicky and stuck on toilets.
That's brilliant, thank you. And the last comment was about the push buttons being very hard to operate. Is that something you've come across?
Countless times. Countless times that people are highly embarrassed because they haven't been able to flush the toilet. The two most difficult are the ones that are flat on the wall with a big button that you press, or the buttons in the side of the system, which is a very difficult maneuver if you have stiff hands. But both of those, first and foremost, are tricky for people with dementia because they don't understand that they are a flush. Of the easiest flush for both aging muscles and someone with dementia is a lever.
Brilliant answer, thank you for that, something to think about. Andrew, there's a question, is there an accreditation programme for dementia friendly design? Can you help us with that one?
I don't know if there is. I'm not sure if any other members could say if there is. I'm not sure if there is one, whether it's something we could look at as a group. Yeah, some sort of basic standards that providers could reach to get that accreditation. Yeah,
that's brilliant. Thank you. And Wendy, there's a question about the quality control on the hub and how you measure the quality of information going on the hub.
Yeah, so as I sort of briefly referenced, I tend to check the links, but I don't check, you know, the care providers, CQC ratings or anything like that, or whether, you know, I find that information, useful. So what I would ask, this is why we've put the rating and the feedback. So actually what we really want is us almost to kind of self-monitor that. So if you go on and you find something really helpful, please rate it. If you go on and you find it that actually the link doesn't work, or you know you think it's kind of not something we should be having on our thing, then obviously you can email me. It will come through to me. So it's sort of something really that we're just putting it there for people to use, but actually the regulation of it we'd all do together, because you know there is so much information out there, and lots of people find things very different as to whether it's helpful or not.
That's brilliant. Thank you, Wendy. And I've got one more question on here, and then I'll just double check I haven't missed any. So I don't know if Debbie or Andrew can help us, or one of the other panel members, with this, but Sarah's asking, is there a group that studies dementia-friendly urban design criteria, thinking about all of the work planning departments will be doing on design codes, which also includes the code for informing designs of public spaces? So I don't know if any of the panel members can help us on that one. Quite a long and involved question. Debbie is putting her hand up. Well done, Debbie. Go on.
I can go do a general sort of feel to it. I mean, general sort of building regs and that kind of route that is out there already tends to try and cover all kinds of accessibility issues, and generally speaking that's actually the bigger issue, that and navigation around spaces, particularly public spaces. In terms of dementia, I'm going to plug a book, hang on, not mine. It's quite an old book, but I still think it's really worth having a look at, by a chap called Gareth Chalfont. It's got the most long-winded title, Design for Nature in Dementia Care, and it is about the gardens, and it's based in care homes, but actually it works in home settings. What I like about his work is it does talk about design, but it keeps the person with dementia at the heart of the conversation throughout it, which I think is rather nice. So I do, from a garden point of view, I'd sort of recommend that. But it comes down to the people, doesn't it, very often?
It does. Thank you. That's brilliant.
Can I just quickly come in, Pam, from the design in terms of academia and
absolutely.
CPD? I know we've got several architects as delegates, and they will, I'm sure they'll acknowledge that organisations like REBA and the Architectural Association haven't put dementia at the heart of a lot of their design qualifications. However, there is a requirement to look at issues around equality and inclusivity. So I think this might be something that can be worked with REBA and the architectural and academic partners to build it in, and also drawing on some of the excellent work from the dementia development centres who already work with individual architects. So we've got Pozzoni on the call, and they've done some fantastic work on this.
Absolutely fantastic. Thank you ever so much for that. And Jennifer, one final one for you. What can you tell us what the advantages are of using the app that you spoke to us about earlier on?
Yeah, I mean, it's something that people have been asking us for quite a while, because I think people sometimes find it a bit more of a faff to be walking around with pieces of paper, when actually doing it on your tablet can be, for some people, quicker and easier to use. But I think it's more around being able to store your results, so you're not having to keep filing everything and, you know, flicking back to different paperwork and everything. It's all on the device that you do it on, and unless you choose to share it with someone, it's safe and secure on your device. And I think when you've got it in an electronic format, hopefully with the comparison spreadsheets that I showed you earlier, it makes it easier to do those comparisons. So I think, and also if you've got someone maybe in a larger organisation who's needing to get information from multiple different housing schemes, for example, getting their assessments in an electronic format via email, for example. So if they download their summary as a PDF or CSV file, they can send it through to that central coordinator, who then, it's a much easier job for them to bring everything together, rather than having to try and, you know, scan in paper copies or manually type things up and send it through. So I think it's more practicalities in terms of how you do the assessment, and also what you do with the results afterwards. It just makes it that bit easier.
Absolutely brilliant. It does sound like a real advantage. So that's great. Thank you. And we've got in the chat a little bit of a plea from Jessica Ettridge, who's asking, could anyone share success stories of how technology has enhanced the lives of people with dementia? Do any of our panelists have anything that jumps to mind? And also, if you want to put it in the chat, your own examples of that, that would be brilliant. So where technology has enhanced the lives of people with dementia. Wonder if any of our panel have anything that's popped straight into your mind.
I know it's probably putting Ali a bit on the spot, because she's not actually on the panel, but she does a lot of work around technology and dementia. So I don't know, Ali, if you, oh yes, she's unmuted herself. Fantastic. Sorry, Ali.
No, sorry. I mean, the thing is to keep it very simple, and to think about normalizing things that are already in the home environment. Andrew mentioned Alexa. I know we shouldn't say that word out loud, because there are many other devices available, but having music and having things that people you know, associate with their lives and their hobbies and their loves and their interests, and just incorporating that through any device, as well as, of course, there's the safety aspects, which we've covered in the design guide. There is so much out there that can enhance people's lives. I'm not going to plug any manufacturer, but there's lots out there.
Well done, Ali. You would be brilliant on the BBC. Other things are available. And actually, Jeremy, we have a question for you from Ali. What do you think about the fact? Yeah, she's squirming.
I'll just say it.
Do it. You ask him, Ali.
It was really funny, because I was on Question Time the other week, and this was my question for Keir Starmer. There is only one mention of dementia in the Labour manifesto, and there are no mentions of carers. What do we think about that, Jeremy?
My hesitancy shows my caution in responding to this, but also acknowledging that the deficit is really poor. My personal view is that we really need to listen much more closely to carers. We need to think much more about how dementia, and perhaps the glimmer of hope from the 2009 strategy that I referred to earlier, if we can revisit that and reboot it, I think that gives us hope. But we have a big economic issues for our nation. What we can demonstrate, if we get the homes right for people with dementia, we get it right for everyone.
Yeah, brilliant. Thank you. And I think that looks like a brilliant question to end on. So you can see there's a lot of information in the chat, and as we said, you will be able to get these slides on the website. So all of this information will be available for you. Just to plug that we do have some more webinars coming up. So in September, diversity and dementia. In dementia, 10th of December, it'll be freezing by then, but we'll be talking about dementia friendly technology, and next March, faith. And obviously, if you want to be involved in any of that, then please do let Vanessa know, and we are open to other topics as well. But for now, I would really like to thank all of the speakers. I think they've all been amazing and so informative. I've certainly learned a lot. I'd like to thank the HousingLIN for hosting this event, particularly Sally. So anybody who's ever shared a screen knows how difficult this all is, and she's done an absolutely sterling job for us. A personal thank you to Ali, who has kept me right in the chat all the way through it, and a big thank you to all of you for attending and making sure that this incredibly important topic stays at the top of our agenda. I hope to see you all again soon in the future, but thank you for now, everybody. Goodbye.
And thank you, Pam, on behalf of the HousingLIN and the team. Thank you for chairing it so eloquently. And if I could just say one final word, if this is the first time you've joined one of our happy hours and our webinars, we have one more for our summer series next week, which is looking more broadly at age-friendly communities. Do join us with another fantastic panel. But on behalf of us, Pam, thanks again, and for fantastic speakers, all really contributed to a brilliant debate.
Thank you. Thank you, everyone.
Thank you very much.
Thank you.